All right, guys, a few more sections to go. Welcome to part 6. Let's get to it. So, dehydration is particularly dangerous to a child because one of the common causes of shock is dehydration. So, it occurs when the fluid lost from the body is greater than the fluid intake of the body. Particularly vomiting and diarrhea are very common causes, not only in adults, but especially in children. This can lead to shock and death if left untreated. One of the other issues with dehydration is the loss of electrolytes, and that can lead to cardiac problems as well because our body relies upon salts, various forms of electrolytes, to do things like muscle contraction. Of course, that affects the heart directly. So mild dehydration, moderate dehydration, and severe dehydration will all present a little bit differently. It can go all the way from being thirsty and just having skin that isn't quite as bouncy and turgorous. If you, especially on a child, if you pinch up their skin, like on me, watch, it just pops right back down. Okay, I'm pretty well hydrated. But on a non-elderly individual, you should be able to tent their skin like that, and it just pops right back down. If you tent their skin up and it doesn't go down, that's a sign of a moderate to severe dehydration. And in severe cases, you're going to see signs of shock setting in because as the body is losing fluids and water, it's not able to function appropriately. So treatment for that really revolves around replenishing those fluids, but we should never be giving fluids or anything by mouth to somebody who does not have a gag reflex or is otherwise unconscious and unable to protect their own airway. Even decreased levels of consciousness, really be careful about trying to give them anything by mouth because you can't assure that they're able to protect their own airway in those cases. So a fever is defined as anything above 100.4. Now, you will see some variation in this depending on which source you look at. A fever in itself is rarely life-threatening. It is the body's own way of fighting off infection because as you increase the body temperature, everything runs slightly faster. Your metabolism is faster. Your immune system is faster. Your enzymes work faster at higher temperatures. Also, bacteria and other foreign substances have a harder time living at elevated temperatures, so that can help your immune system fight off the infection. Heat loss is generally decreased in these circumstances because your body is trying to retain as much heat as possible. So, an accurate temperature is important in pediatric patients because this can be a sign of a lot of different, potentially life-threatening illnesses, and it can also lead you to things about seizures, which we'll talk about, I think, in a little bit here. So, here are some signs and symptoms of things that you may see with these patients. Signs of shock, respiratory distress. Be very careful of this one: a stiff neck. Okay, that can result just from regular old fever, but a stiff neck, something that they don't really want to turn their head at all. They can't do this, and to turn and look, they'll move their entire body. That can be a particular sign of meningitis. So make sure that you're taking good, adequate precautions if you see that. Hot, flushed skin. In infants, you'll see a bulging fontanelle, that top at the part of their head that's just bulged upward. Those are all present in a fever. Okay, look for those things. Febrile seizures are a very common cause of seizure in younger children especially. This is a seizure that is caused by the fever alone, and it is typically found on the first day of a febrile illness. They're also characterized by a sudden increase in fever, and that's one of the things that we think may cause that is the body is just unable to deal with the sudden increase in temperature if they go up too fast. So if the fever is brought on too quickly, you'll see these tonic-clonic seizures that occur, and then the fever may go down a little bit afterwards. They're usually less than 15 minutes, and the postictal state is usually smaller or absent. So ask for, have they been ill recently? Have they been sick today and not behaving normally? Have you taken a temperature? Has it been elevated? When you feel them, they may very well feel very hot. So take that temperature and see where it's at now. Of course, it can be the sign of a more serious illness, and if the seizures aren't managed, they can be just as dangerous as any other seizure. We're still going to treat them the same way. We're going to let the seizure pass, protect the airway as much as possible, and transport. Drowning is the second most common cause of unintentional death in children. Kids less than 5 are at the highest risk. And with adolescents, alcohol is a big factor. So stay away from drugs and alcohol. Okay, it's just bad for you. Of course, the principal cause of death in this circumstance is a lack of oxygen. They're not able to get oxygen in, so they can't perfuse, and they die. As a few minutes, so 4 to 6 minutes in an adult causes brain damage. Okay, and 6 to 8 minutes is irreversible. Might be less, might be more when it comes to children, depending on their age, size, and what they've drowned in. We talked about cold emergencies and how cold water cardiac arrest is something that somebody's not dead until they're warm and dead because of the mammalian dive reflex, causing their body to slow down and go into more a state of almost suspended animation. Always consider spine and neck precautions and those injuries. If there was a diving mechanism involved, they may have landed head first. All right. Trauma is the #1 killer of children in the United States. Okay. A big part of that is what care they receive. Is it near a trauma center? Do they actually get trauma level care, or is the facility not capable of doing that? So again, #1 killer, it affects a lot of the bones, which do continue to grow into adolescence. Femur fracture, specifically in children, is pretty rare. That's not normally where their trauma occurs. But if it does occur, it can be a significant source of blood loss. You can still treat them normally, but know that they may bleed more than the adult will. They may be showing signs of hypovolemic shock just from a leg injury. Okay. Of course, the older that you get, the more prone you are to long bone fractures. So older school age and adolescents are much more prone to long bone fractures. And your long bones, don't forget, lower legs, femurs, forearms, and humerus. Okay. Those are all of our major long bones in our body. So because the physical size between adults and children, you're going to see locations at different sites depending on the mechanism. Okay, so because a child's bones are more cartilaginous and less calcified, they're not as hard, they're going to bend. And so that force, that energy will affect the bones differently. Their head and neck are proportionally larger, so those injuries to their head and neck can be more severe than an adult's, even with a same, more minor mechanism. Okay, their underdeveloped judgment, sense, and lack of experience leads children to do riskier things or feel like they are invincible. It's not the case. They can still be injured. Deceleration injuries are particularly common in terms of a source for neck injuries, right? So that's that forward motion and whiplash that occur. That's a deceleration injury. And you can still have all those shearing and compression forces that we talked about before. You need to consider the mechanism of that injury. Injury patterns are something that we see in children depending on what caused them. High energy mechanisms typically result in injuries to the head, spine, abdomen, pelvis, and or legs. Okay, the common way that you'll see this are kids that run out in front of and get hit by a car. So you need to think about the physical and the psychologic characteristics of children in these circumstances. Sports injuries are also pretty common. You'll see a different injury pattern here. It depends on the type of sport they're playing. Contact sports can result in head and neck injuries. So think about the cervical spine immobilization. Think about your C-spine precautions in these patients. So, as I've said multiple times, children's heads are bigger, so head injuries are more common. The infant has a softer, thinner skull. It's not fully developed, may not even be one complete bone yet. So think about the possibility for skull fracture or internal bleeds. Just like with adults, facial and scalp vessels and lacerations that occur in those areas will cause a higher rate of bleeding, and they can cause a significant amount of bleeding if they're not controlled. Head injury will present very similar to adults as in children. You're doing nausea, vomiting, loss of consciousness, altered level of consciousness. Are they confused? Are they lethargic? Those are all things to look for. So you should immobilize all children with a possible head or neck injury after a traumatic event. As far as the national level goes, they still need full spinal immobilization and precautions. Because of their proportions, it can be difficult. I talked about their occiput being bigger. We don't want to immobilize them like this, however. If you're immobilizing someone and because their head is so big it goes down, that's not protecting their neck. You may need to pad underneath their shoulders so their head lays more flat than you would on an adult. So pay very close attention to make sure they're in a good anatomical alignment and not sitting there with their head pushed forward. Chest injuries in children are usually the result of blunt trauma. This can produce flail chest. This can produce pneumothorax, hemothorax. All of the chest trauma mechanisms and injuries that we talked about in the last block can be present on a child. Abdominal injuries, I mentioned towards the beginning that they don't have as developed abdominal muscles. So they are more prone to abdominal injuries, not only because of that, but because their organs proportionally are bigger. So they can have internal bleeding. Watch for those signs of shock. Watch for the signs of abdominal distension, bruising being one of the earliest signs that you'll see. Okay? And then just treat for shock as you find it. Okay? So, in a child, greater than 25%, any more than 25% of their blood volume lost is significant when it comes to their risk for shock. Okay? Compared to an adult, they have to get to 30 to 40%. So it is more serious in a child. You're going to see signs of shock in children that will include skin signs like poor cap refill, mental status changes, and tachycardia, as opposed to an adult that you'll see hypotension sooner, but still presenting with tachycardia and mental status changes. Okay. Burns to children are more serious than burns to adult. Their body surface area is higher relative to their total, so that head is worth more percentage points. Their chest is worth more percentage points, legs, and so on. They also don't tolerate those burns as well. So they will go into shock sooner than an adult will with even a smaller burn. They're more likely to develop hypothermia because they cannot protect their body temperatures as much. Okay, they're not able to compensate as well, and their airway is also a problem. So these are the most common exposures for burns in children: hot substances, reaching up to hot things on a stove, and caustic substances. Those would be poisons, bleach, acids, bases, things like that. With any burn, infection is a concern and a very common problem. So be as sterile as possible. Use your sterile burn sheets or to clean those wounds and to dress them. Okay. You have to think about child abuse in any burn situation. Now, that doesn't mean that all burns should be reported as child abuse, but you need to start thinking about it very early on because you need to look for their injury patterns. You need to look for how severe was it? Do you see burn patterns that may indicate immersion? And we're going to talk about child abuse here coming up towards the end of this chapter. All right. So I talked earlier about growth plates and how injuries to the bones and the extremities can result in growth abnormalities. The growth in the long bones occurs from the ends at those growth plates, and those tend to be weak spots on the bone. It's where osteogenesis is happening. That's the process of creating new bones. And they're more likely to have an incomplete or a green stick fracture because their bones are less dense and less hard. They're more cartilaginous than on an adult. Okay, but you're still going to manage them the same way. You're going to splint things. You're going to, use cold packs as necessary. You're still going to treat them in the same way as you would an adult extremity injury. So, Wong-Baker face pain scale should be used in pediatric patients that are in pain. They may not be able to give you a good number, but they may be able to point to that line of, going from smiley face to sad face and tell you how bad is their pain. Our interventions at the EMT basic level are kind of limited. Okay, the whole Rice mnemonic is important. Ice, elevating their extremity, dealing with swelling, and splinting can all help decrease pain. Okay, but you may need ALS interventions for further pain control and emotional support for those patients as well. All right, I'll see you guys in the next section.